Hi, I'm Justin Riley. Today on Wisconsin Doctors, October is Breast Cancer Awareness Month, and we're on location at Bluff Medical Center learning about preventions and treatments for breast cancer. We'll learn about prevention, screenings, mammography, and genetics testing, and how being aware of changes in your body is crucial, as catching breast cancer early is the key to treating it. My guests will include Christine Jensen, family medicine physician's assistant, Kelly Honold, Lee CT and mammography technologist, Dr. Pamela Propek, breast imaging physician and professor of radiology at UW, and Elaine Vanderslice, member of the Bluff Medical Center Friends of Foundation and a two-time breast cancer survivor. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center in Mauston, and being that next month, the month of October, is Breast Cancer Awareness Month, our topic today is screenings for breast cancer and prevention. And I'm joined by a fabulous panel. Welcome, everybody. Good to have you here with us. And I'm going to start with Christine Jensen. Christine, we're talking about breast cancer awareness, obviously. So since you're a primary care physician, could you start us off by touching on some of the preventative measures that can be taken to reduce people's risk of developing breast cancer?
Sure. I'm a primary care physician assistant, not a physician.
Okay, thank you. Sorry.
So I think it's really important to establish a relationship with a primary care provider, whether it be a physician assistant, or a nurse practitioner, whoever you feel comfortable seeing, because that's a person who's going to get to know you and your body and the changes in your body. Seeing that person once a year is very important, especially for breast cancer prevention, and knowing your risk factors. You can't change things like heredity, age, those kinds of things, but you can do a lot with lifestyle changes like weight and exercise, the way you eat, smoking, alcohol. All of those things can help to decrease your risk of breast cancer.
Yeah, so even though you may have genetic tendencies towards something like that, you can kind of beat the odds to some extent, hopefully, by just maintaining a healthy lifestyle.
Absolutely.
Yeah, good.
Absolutely.
And Kelly Honold, I want to jump over to you. Welcome back to the show, by the way. It's been a while since we've seen you. You're involved in the mammogram screenings that take place here at Bluff Medical Center. Can you share with viewers the current recommendations for mammography?
Sure. Recommendations for screening mammography vary. It is important to have screening mammography about every 1 to 2 years. Like Christine said, you need to establish that care with your primary care provider, and they will decide what's best for you based off of your age, gender, family history, personal history. Dr. Propek, do you have anything to add?
I would agree with that. I think it's really shared decision making with you and your primary care provider, so I can't encourage you enough to stay in touch with your primary care provider. If you notice any changes in your breast, get right in to see them, and they can order the appropriate tests so that we can work these things up, deal with them early rather than later. And I don't want people to get hung up with this every year, every other year. It's just be sure you've got that contact with your primary care provider, and together you can come up with a screening recommendation that works best for your situation.
Okay, so we've talked about prevention, and Dr. Pam Propek, as a breast imaging physician, what advice would you give women for increasing the likelihood of surviving a breast cancer diagnosis?
Well, I think the first thing is to be aware of your body, and when you notice a change, to go to your physician. Don't put it off. Don't say, oh, it's nothing. Do not be afraid to come in and have it checked out, because the earlier we can find it, the better off that you will do. I think that's the main thing. And then stay on top of screenings. Don't go 5-10 years. You want to go every year to every other year.
Right. Every year is important for viewers to know. Elaine Vanderslice, we're happy to have you here today because you are actually a breast cancer survivor. So we're very happy to have you. Can you share just a little bit about your story and how your cancer was first detected?
Sure. I was a 28-year-old young mom
Wow, 28. Wow.
I had 2 little kids, a 7-year-old son and a 4-year-old daughter. I'm healthy, not a smoker, no family history. I was actually cold, and I was putting my hands under my armpits, and that's how I felt it. And I went to the doctor the next day, and the whole process started.
Wow, so something as seemingly harmless as just having cold hands could be something that's a little bit more serious. Wow, wow. Well, thank you for sharing your story, Elaine. We're going to talk to you a little bit later on in the show. We're going to take a short break here, and when we come back, we're going to continue talking about breast cancer in honor of Breast Cancer Awareness Month here on Wisconsin Doctors at Mile Bluff Medical Center. Stick around. Welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center, and we are discussing prevention and treatment of breast cancer in honor of Breast Cancer Awareness Month coming up in October. And I want to talk a little bit about screenings specifically in this segment. And Christine, since the first recommendation started at home with just awareness of changes in your body, can you walk viewers through exactly what they should be looking for or paying attention to?
Sure. I think it's important that every woman get to know the architecture of her own breasts. Taking not necessarily an exam, but making sure that you know what your breasts look like in the mirror, what the skin looks like, and noticing if there's any changes in that, whether that be a lump or whether that be scaling of the skin or redness, irritation, even under the armpits. The breast tissue is not just limited to the breast that we consider. It goes all the way to the breastbone, all the way underneath, and then under the armpit as well. And you need to kind of just be familiar with what it normally feels like to you and keep track of that.
And I think that's important to note how it feels too.
Absolutely.
And how you feel, because
Absolutely.
changes in how a person feels in general could be indicative of something going on internally. So,
Absolutely.
yeah. Kelly Honnold, can you talk about how someone can go about scheduling a mammogram here in Mile Bluff?
There's several different ways to schedule a mammogram here at Mile Bluff. If you're in clinic and you're seeing your primary care physician, and their recommendation is to have a mammogram, they'll place an electronic order that'll go to scheduling. Scheduling will contact you and get that scheduled at your convenience. If you are over the age of 50, you do not have to see a primary care physician prior to having a mammogram. You can go ahead and call centralized scheduling or the medical imaging department, and we can get that scheduled for you. We do take walk-in mammograms here at Mile Bluff, so if you're in for some blood work or seeing a different doctor and you know that it's been a year since your last mammogram, you can go ahead and come into our department and we can get your mammogram done that day.
We want to make sure that we remove as many barriers as possible to those folks who feel they may actually need it. So, Dr. Propek, you are a breast imaging physician and professor of radiology at UW. And can you describe your role as a member of UW's community radiology program and how you work with Mile Bluff to provide medical imaging care and services to patients here in Mauston?
Sure. So we have a community division that is dedicated towards providing excellent patient care to the surrounding communities. And what we do is we have a group of radiologists who specialize in mammography as one of their areas, and we will interpret those mammograms. What you may not be aware of is that to read mammograms, you have to have certain qualifications. You have to have a certain amount of education, certain amount of reading studies, and then you also have to be audited so that they look at your results to make sure that you're performing at a certain level. So we have this qualified group of radiologists, and what we do is we read the screening mammograms remotely, meaning that those go on a PAC system to where our radiologists are sitting. They'll read those mammograms, then they'll generate the report, and then if there's a concern from the mammogram, they will get called back for a diagnostic mammogram. And then we also have radiologists come here to Mauston to oversee the mammograms, the ultrasounds, and provide the biopsies if those are needed as well.
Okay, so there's some teamwork, there's some cross-checking of the information to make sure that everything is accurate and the correct information is getting to the patient.
Yes.
That's awesome. And Elaine, I'm wondering if you have any advice for folks who might be putting off getting their recommended screenings out of fear.
Well, I would say fear of the unknown is worse, a lot worse than knowing what you're dealing with.
Right.
You should follow your intuition and go to the doctor as soon as possible. Early detection is your best chance. There's always hope. And it might be nothing. You might be afraid for no reason at all.
Yeah.
So working along with your doctors, I think, is the best thing for you. And 28 years later, you might have 4 granddaughters and a little grandson on the way.
Wow, congratulations.
Yep.
That's so awesome. We're going to take a short break, and when we come back, we're going to continue talking about this topic here at Mile Bluff Medical Center. Don't go away. There's more Wisconsin Doctors coming up after the break. Welcome back to Wisconsin Doctors. We are here at Mile Bluff Medical Center, and we are talking about prevention and treatment of breast cancer, seeing how October is Breast Cancer Awareness Month. And Kelly, I'm going to start with you because your area of expertise is mammography, which is what we're talking about in this particular segment. Can you walk us through what a woman can expect during a mammogram?
Sure. What you can expect during a mammogram is you will come to the medical imaging department, we'll take you in the mammography room, you'll change into a gown. Sometimes it's easier if you wear a skirt or some pants, so you don't have to fully disrobe. Some people are a little modest about being in a gown. And then make sure you don't have any powders, deodorants, lotions on the chest area, the breast, under the arm. If you do, we'll have you wash that off that day. Sometimes that can get in the images, and so we make sure that you don't have that. You have to be able to, move freely and work with a technologist when you are getting your images. So if you've had recent surgery on your shoulders, or you're not able to stand well, or you're in a wheelchair, it's probably not the best time to have your screening mammogram, so you really need to take that into consideration. We will get your images by compressing your breast tissue. The more compression, the better the images. It kind of separates that breast tissue out, and there's less chance of any cancers or any abnormalities to hide in that tissue. We'll take the image, and then the paddle is immediately released. And then we will have those images sent to a PACS imaging system, like Dr. Propek said earlier. They'll be read by a radiologist, and then our patients will get a lay letter in the mail of their report, and then we also send those results to their primary care provider.
And Dr. Propek, when you are reviewing these images, when these images come to you, what exactly do you look for?
Well, we look for a lot of different things. We look for masses, we look for calcifications, we look for any architectural distortions. I think one of the important things is that we also like to compare to the prior films. Like we talked about changes in the breast tissue. On physical exam, we also look for subtle changes on the mammogram. So if you moved from somewhere else and have a mammogram from a different institution, it's very important that you get us those images as well, because that can decrease your callback rate, and that helps the radiologist make a better interpretation of your study.
So if you're saying that if you have mammograms taken in a different health system outside of your current health system, it's the patient's responsibility to make sure that they get those images sent over.
Yes, because that will make your interpretation of the mammogram better. It'll be more likely to pick up subtle changes because we'll be able to see a difference from the prior exam.
Be able to compare,
contrast.
Christine, can you talk about what's next? If somebody in an unfortunate circumstance has a diagnosis of breast cancer, what comes next?
Well, as we said before, early diagnosis is totally key. But breast cancer, it's highly treatable in many cases, and so getting in to see your care provider, getting set up with an oncologist is going to be kind of key. Here at Mile Bluff, we are very fortunate because we have oncologists from UW that come in and work really well with our team. We've got an IV infusion center, cancer care center, and then they work really well together. There's also a new program in this area that I just found out about called Look Good, Feel Better, where cosmetologists from the local area are helping breast cancer survivors or breast cancer patients with more of the appearance kind of side of it. And so they're giving wigs and helping with cosmetology and those kinds of issues. So I think that's a wonderful program.
Look Good, Feel Better is the name of it?
Look Good, Feel Better.
That's excellent.
Yeah.
That's excellent. And Elaine, obviously this is a very personal connection for you. How do you feel knowing that so much of the care that you need is available right here in Mauston?
Well, we all know getting a mammogram isn't fun. Maybe you don't know that.
So I've heard.
It's a gift you should give yourself, though. And for me, it makes it a lot easier coming to my local hospital, my hometown, where I know the people like Kelly are going to be there with me.
You don't have to drive through traffic or anything.
Correct.
You can come right here.
And that makes
right
it
here
more
at home.
stressful, so it's good to just be here in your hometown.
Absolutely, absolutely. We're going to take a short break. We're going to continue talking about this in just a moment, right after the break here at Mile Bluff Medical Center on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We've been discussing breast cancer awareness and prevention here at Mile Bluff Medical Center. And you know, genetic testing is something that we haven't talked about yet, but I'd like to talk a little bit about that during this segment. And it's been, along with cancer risk, associated with genetic testing, has been in the news a lot. And Dr. Propek, what can you tell us about genetic testing, and what is it, who should do it, and is that something that's covered by insurance?
Sure. Genetic testing is, I think, a very great tool that we've developed over time to help stratify patients. But the one point I want to make sure everyone's aware of is that most breast cancers occur in women who do not have the genetic markers. So, again, don't ignore changes in your breast just because you don't have a family history.
Right.
Be very careful about that. But there are some parts of your history that are concerning, and you would need to think about the need for genetic testing. And this would be women who have a very strong family history, multiple siblings, premenopausal mother. If your father has breast cancer, that also puts you at an increased risk. So all of those things you need to look at. If there are other cancers in your family, such as ovarian or colon cancer, you might need to look at the genetics testing. If you've had treatment for other cancers, such as lymphoma, where you've received radiation to your chest area, that also puts you at an increased risk of breast cancer. So these type of people may need the increased screening. And what genetics testing does is if you reach a certain threshold, it's actually about 20%, then we also recommend adding screening breast MRI to your evaluation. So if you get the genetics testing and you find that you're at this increased risk of 20% or greater, we also would recommend that you get the screening MRI. So this is a point that you need to work with your primary care physician. They can decide if you need to see a genetics counselor or geneticist to do the genetic screening. It depends on your insurance. Some insurances will cover, some won't, so you need to check with your individual carrier. But I think the key thing is working with your primary care healthcare provider, looking at your risk factors, and then if you do have the genetics testing and you end up having a genetic mutation, it's a BRCA1 or BRCA2, then you would probably need that screening breast MRI in addition to mammography.
And as you had said before, if you've recently changed healthcare networks to make sure that your primary care physician knows your history and knows all the risk factors that you have, if you are aware of them. Christine, why, obviously Dr. Propek has highlighted some of the reasons why these risk assessments are so important, but can you give your take on why a risk assessment is so important?
Well, as we said kind of throughout the entire program, it's really important for early detection.
Right.
If you know your risk, you can change the risk factors that you can change. If you know your risk, you can get in for screening earlier, and the earlier that you're diagnosed, the better your chances for survival.
Yeah, time is a factor there.
Absolutely.
For sure. And Elaine, when you were first diagnosed with breast cancer, this was something that genetic testing was something that was not even available at the time. I mean, was that something that you would have done if it would have been available to you? And do you have family members now who have undergone genetic testing, knowing their family history?
Well, like you said, it wasn't available at the time. I think I probably would have had it been available to me, because I was so young and I wanted to survive, so I was doing anything I possibly could. No one in my family has done it yet, but in 2011 I decided to go ahead and do it because of my sisters, my granddaughters, my daughter. And on my daughter's 28th birthday, I was able to tell her I'm not a carrier.
That's awesome. That's a great birthday present.
Yep.
Very good, very good. Kelly, is there anything that you would like people to know about the diagnostic services here at Mile Bluff before we go?
All I have to say is that we have a great team here. We have the state-of-the-art equipment, and you're in good hands here at Mile Bluff, and we're here to serve you.
Awesome. Awesome. Well, thank you so much for having us here today. We are about out of time. I appreciate all the information. My guests have included Christine Jensen, Kelly Honold, Dr. Pam Propek, and Elaine Vanderslice. Thank you so much for sharing all of your insights. We've been talking today about breast cancer awareness and prevention here in honor of October being Breast Cancer Awareness Month. If you sense any changes in your body, please be aware of them and get with your primary care physician as soon as possible. That's all the time we have for today on Wisconsin Doctors. From all of us here at Wisconsin's 57 and Mile Bluff Medical Center, we're inviting you to live longer, live better. We'll see you next time.